Hi folks. I don't, as a habit, rely on mainstream media for my source of information, especially in regards to COVID-19 and especially in regards to aged care deaths. Now, I happened to come across today just a snippet from MSN, which is Channel 9. And of course, it was blazoned across the screen, as it would probably be blazoned across the newspapers in Melbourne and the national rags. Breaking news: 7 of 9 deaths came out of aged care homes in Victoria. 7 of the 9 deaths, yesterday or today, came out of aged care homes in Victoria. Folks, this is an absolute lie. This is an absolute lie. I'm not buying into it. I do not believe it. And there is something really sinister going on with aged care. Now, just as a precursor to what I'm going to say, and I'm going to read from a blurb that I've written because it's a lot easier. I don't want to miss anything out. But as a precursor to that, everyone needs to remember that before COVID, before January, the aged care industry in Australia was under a royal commission. And in fact, the Aged Care Royal Commission has been extended about 2-3 times now. The last extension I recall for submissions to be lodged to the Aged Care Royal Commission was till the 30th of June. I don't know if it's been extended beyond that. But I think as a result of all the fuckery that was going on in aged care because of the COVID directions, I think someone in the Royal Commission, under pressure, made the decision to extend the deadline for submissions. Now, so that was going on prior to COVID. The Aged Care Royal Commission revealed a lot of nefarious activities, a lot of cruelty going on in aged care, a lot of nefarious activities. And these were most of these submissions were from aged care staff, aged care managers, and families. There was a Four Corners story done on it late last year, an expose. There was one particularly bad case which was very heavily publicised about an old man that was being abused by 2 care staff. But many other cases and submissions were made to the Aged Care Royal Commission that painted a very grim picture of aged care. What happens? COVID comes along. All of a sudden, guess what? Families are locked out of aged care. That's no coincidence, guys. No coincidence whatsoever. We've got a Royal Commission leading up to COVID. Whistleblower families that probably weren't getting anywhere with the aged care facilities, or they were getting, cover-ups and, oh, don't worry, we fixed that, or they were getting lies. Well, suddenly, guess what? All those families and relatives and loved ones were suddenly locked out of aged care, right? So they couldn't see what was going on. Families, since March this year, families haven't had a proper vista into the aged care facility where their parents are or their loved ones are. Okay, so that's the precursor. What I want to say is this: how is it possible that there have been more reported aged care deaths from COVID-19 in this country? Just think about it sanely, logically, and rationally for 5 seconds, for a brief minute, please. Since at least March 23 this year, as you know, most aged care homes in Australia have been in visitor prohibition lockdown in some form or another because of Avoid-19 and those Avoid-19 directions. And these, of course, encompassed a flu vaccination requirement, which was implemented on the 1st of May by the federal government during COVID and as part of the COVID-19 response. Okay? Now, when that small window of time was made available where the nursing homes started lifting the lockout restrictions and families were once again allowed to visit inside, there were very, very strict protocols put in place by most aged care facilities as a precautionary measure, just in case there was embers out there in the community that might be brought in again to aged care. And so just in case someone brought in the reported plague. These included visiting your loved one in isolation, away from other residents. You had to see your loved one in their room or in some other room in the facility, away from other residents and other people. Any items you brought in for your loved one were heavily screened, they were sprayed, disinfected, they were checked to see if they were okay. You had to have a temperature check, you had to fill out a disclosure of travel and movement form, and visitors couldn't roam the facility freely, right? You had to stay put with your loved one, basically. Whilst inside, you had to sanitize. Crazy, right? This was only for a short time. I'd say probably, from memory, about 3 weeks max. Then, whammo. The government and their media shills started building the narrative slowly, but then it exponentially got stronger, the narrative, about the dreaded second wave of Avoid-19. Now, as that narrative ramped up and in the media and from the daily public health talking points, we once again saw a spike in aged care cases, which of course fed into the narrative of the aged care facilities, who just loved it because once again they could close their doors to visitors and implement even stricter, harsher protocols for their staff, for their contractors, and for any so-called allowed essential visitors, right? That reported second wave and second round of aged care lockdowns brought with it, strict entry and movement requirements into aged care. Contractors, deliverers and staff. Masks were now required. Still had to have the flu shot, and stricter disclosure was required for people who had been, who had recently travelled to hotspots like Melbourne, for example, as Melbourne was touted reported as the new COVID hotspot. You could not actually enter an aged care facility at all, whether you were staff or contractor or other essential visitor, until you'd quarantined yourself if you'd been to Melbourne. Now, visitors were still locked out completely, and residents were once again deprived of meaningful contact with loved ones. This has been going on, folks, since the 23rd of March, something like 152 days now. Meanwhile, out in the community, as a result of this reported second wave, all the states, or most of the states as I understand it, were back to phase 1, phase 2, phase 3 lockdowns in reverse, and aged care staff were now required to jump through even stricter protocols for engaging with the residents. These included changing their clothes when they got to work and then when they left work, so they could be decontaminated, and now they had to wear masks as well. I can attest to that because when I've rung my mum via video conference or video call, I've actually seen all the staff wearing masks, and I've even seen some of the residents wearing masks. Yes, folks. Elderly people with dementia, Alzheimer's, and a range of other health problems walking around with masks on inside a nursing home. How's that for looking after the health of the residents? So, considering all these wonderful so-called proven protocols, which Australian public health officials and state leaders have directed to aged care homes, who've just followed blindly all these directions, I might add, knowing, I think they must know by now that something's not right, okay? Despite all the rebirth of phase 1, 2, 3 protocols, despite communities being forced to wear masks now, and despite the curfews and the movement limits, I'm mainly referring to Victoria at the moment, and all the bloody sanitising and cleaning, despite all that, despite all those protocols, they are once again reporting cases or deaths in aged care homes. And it's blazoned all across the news. It makes no sense whatsoever, guys. And I'm calling it out as another big fat lie by mainstream media, the government and public health officials. And until I see proven evidentiary factual data of these deaths and cases, I will not allow myself to be once again duped, fooled and manipulated and insulted on behalf of my mother, and insulted by this latest fear ploy to keep everyone afraid and to keep families out of aged care. I'm simply not buying into it. And I encourage anyone else who has loved ones in aged care right now that hasn't seen them for 152 days to do the same thing, and do not believe, try not even to read or glimpse what they're now reporting again, building up this aged care narrative again in the media. Do not believe it, do not buy into it, and start asking for the proof, guys. They can redact stuff, they don't have to give names, but they can give more fact-based evidence. We're going to start calling these bastards out. We're going to start calling them out on the info that they're reporting. Hey, that's the media, and also the public health officials. We're going to start calling them out big time. We cannot let this continue, guys. The basic rights of an elderly person in the community, in a nursing home, just in society in general, they do not get suspended in a crisis. They're fortified. We should be looking after them more. So that's all I wanted to say. And yeah, thanks for listening. Rant over. See you guys. Bye.